I know the town of Hartford, right next door. I was looking for a town manager. Me, I have a master's of healthcare administration from the best program in America. I've worked for physician boards for good 15 years, including private physicians, here in New England. And importantly, I implemented one of the nation's first community paramedic programs, which help reduce 911 calls and bring paramedics to bear on working with primary care physicians on reducing emergencies, keeping patients out of the hospital, out of the emergency room, containing costs, including for employees, through a careful risk screening of who would be most appropriate for that level of care. If you look at the data, one of the best predictors of somebody having, like an 11th emergency room visit inside of 12 months, whether they're a town employee or a town resident, is whether they had 9 visits. And that data happens to be available to the town. And being, very careful about involving the primary care physician in a way that leads to a healthier population, a more cared for population, and allowing paramedics to work at the top of their license. America has the best paramedics the whole world over. If you look overseas, paramedics are allowed to do a whole lot more and are incredibly well trained. And they do have to work in concert with physicians. But for the town, we have an incredible base of paramedics. Allowing them through a career ladder to reduce 911 phone calls, originating from residents and from employees, would be an area of opportunity for containing costs and also, improving the health of all of us in the Upper Valley. We know that program is incredibly effective where it's been implemented in other states. And again, for our particular city in Hartford, Vermont, keeping and containing hospital costs happen to be one of the most important expense line items for the town. It is also a great opportunity for paramedics to learn and grow in the old Kent English tradition of paramedics. Again, where paramedics originate more from a military training in origin. In Vermont has done more than its share with military service. The select board, I'm very curious to hear what their priorities are. Again, I've worked for physician boards my whole career, where physicians own their medical practice. Hartford, Vermont is a little lighter in its physician mix. That would be something that I'd be willing to lend my expertise and help with. Introducing primary care physicians in larger numbers to care for the town happens to be an area of opportunity. Folks in Hartford don't need to leave Vermont to get first-rate care. And we can offer new options that are, offer conservative chronic disease management programs in concert with a community paramedic program. I do have, experience with a lot of FTEs, physicians, nurses, and my experience is that, dealing with annual contracts is about, establishing a professional roster. The town of Hartford, Vermont deserves a professional roster. Something that we can take a look at annually, quarterly. My experience is if you give people an opportunity to perform higher and you give them a career ladder, the sky's the limit. I had secretaries earlier in my career that were so fast at answering the telephone and scheduling appointments with our clinics that they rose to be emergency room medicine physicians, which is not something that you see everywhere in every community. And so that mentality of trying to offer development where people have careers that go up in the town, through the town, across the town, and deepen our connection with other parts of New England. The organizational culture, I happen to have grown up in the Midwest. On my father's side, we're descended of the Lithuanian Knights that came to upstate New York to build West Point in the old-time tradition of white knights on white horses. That's been my mentality. As an executive, again, which my career has been with physicians. We run across multiple towns, often across the whole state, in specialties, particularly primary care and orthopedics, which are two necessary areas of care. And if you look at what some of your highest cost diagnoses are, at Hartford, you'd find that it's primary care diagnoses, orthopedic diagnoses, and see work-related injury, which is something that I've been involved with states and with physicians on the workers' compensation programs, so that employees, residents are able to get in today for care. I built a model with Concord Orthopedics, which is the acute injury clinic. It happens to be a model for the whole rest of the nation. There happens to not be one in Hartford, Vermont. There's no reason why there couldn't be one in Hartford, Vermont. That opportunity is for you to get the same level of specialty care from physicians in the community and not at the hospital, and not incurring a hospital expense. The whole idea is reducing the expenditure in the hospital. Again, which is, from a finance perspective, would be one of the higher priorities operationally with any town in America. And again, I've spent my whole career, and again, I have I'm humbled to be the James A. Hamilton Award winner from the University of Minnesota's MHA program, the best healthcare administration program in the world. Where I've been delighted to learn quality and finance of healthcare at an intimate level, down at a procedure level, down at a diagnosis level. I'm a peer-reviewed, published scientist. I've published multiple books. Right now, my book, Perfecting the Brand American Medicine, is about fixing our healthcare system. Something that I feel passionate about, something that can be done at a town level, something that helps the town. 20% of America's healthcare expenses, 20% of America's economy is healthcare, which is my area of expertise. And I can tell you, from employee engagement, one of the best ways you can show your employees if you care about them is give them all the tools they need to do their job. Make sure they're seen today for care when they're injured. Work with them to make them feel welcome to come back to work if they happen to be injured, and provide them great benefits. And those benefits are only as good as the network of physicians. And I happen to believe that the Vermont side of the border is wide open to having more physicians, more primary care, more home care. Recruiting folks that do that industry is not simple, and it takes having a lure to sort of draw folks in. And again, we have the opportunity of doing a community paramedic program. Could be the best in the nation. Which again contains costs for the town, contains costs for the residents, and again is a way to, in very concrete ways, reduce 911 calls. If you look at my publications, I am one of America's best peer-reviewed addiction scientists. If you go back to, I'm 15 years ago, published as an expert on running treatment drugs to get, at the University of Minnesota to get monkeys off of crack cocaine, PCP, and methamphetamine. In that work, I've continued working with hospitals, physician groups, pharmacy wholesalers to eliminate prescription diversion, which is a high priority in towns, just like Hartford, where we know that the diversion of narcotics is originating from a small number of players in the field. I've confronted those players elsewhere in America. I've worked under agreement with the New York Attorney General's office to reduce diversion I was actually hired on the corporate side of one of the largest pharmacy wholesalers in America, and wrote an algorithm to make sure that patients are not prescribed too much painkillers, to make sure that pharmacies are not ordering unusual frequency of narcotics. And that kind of a program can be implemented at a town level. We have all the data to look at where our formulary of spending is going, and crack that down real aggressively. The amount of painkillers is, again, hugely. Like I know for New Hampshire is 3 times the pain prescribing dosage of what's in Minnesota. And I mean, people in Minnesota aren't writhing in pain; there isn't drug seeking there. And so, as town manager, I'd be happy to bring a diversion prevention program to the community, and to the workers in the town. Because again, the workers deserve to have the best benefits and not to have misuse, misdiagnosis, and over ordering of painkillers. And again, me, again, I had, come with a lean management and Six Sigma training. I have my own quality improvement methodology, which is named similarly after Dr. Seuss's, pen name of, Dr. Seuss. It's called Suspect, which is systems, energy, units, seconds, and time, process, expectation, cycles, and topologies. It happens to be like the Baconian method, but it has room for machine learning, which is some of the work that I, do with physicians, and other stakeholders. And me, I've worked with a lot of I've been pleased and delighted to work with a lot of folks that have really high expectations, whether they be surgeons. I had the pleasure of working for a ex-captain of a nuclear submarine who spent the Cold War circling the Mediterranean with the keystone of the world around his neck. And he had very high expectations for my physicians, for my clinics. We rose to the occasion. I know that, folks in New England have very high expectations for their officials. I know that I can rise to that occasion. I'm inherently a positive, proactive individual. That's spent my childhood, 10 years of my childhood, as part of the Olympic hopeful movement, where I was a competitive swimmer and an all-American swimmer. And so I know that I can quickly gain the trust and respect of the selectmen, give and get constructive criticism, and even productive criticism. Because I think the opportunity is huge if you look at what services can be provided and what cost containment can be offered. Hartford Event Center, the old church, would be a great place to elevate its occupancy. I happened to notice during the 4th of July event that the road back there happens to not be paved. It happens to not be occupied, and I'd love to get a education programs there, training programs there. I have a proposal in front of a competing town to build a college of nights that are professional school only, that would train in healthcare patient attribution, healthcare overhead containment, healthcare marketing, and healthcare facility design, of which those are 4 areas that I've been at the top of those fields for 15 years or so, and want to be able to help teach, help give back, and offer professional school options that first in the nation, to reintroduce the tradition of chivalry and knighthood. Through we have budgeted a cohort of 24 in our first year, and we'd love to bring that to the Hartford Event Center. It could function as a seminary, a seminary in the Kent English tradition, where we help commission paramedics to be community paramedics, help commission knights that have a higher level of training in hospital administration and medical practice administration. I happen to have a bachelor's degree with honors. I do have a master's degree in healthcare administration, from the best program in the world, the University of Minnesota. I was provided the James A. Hamilton Award from my peers. The administration of public services, including Medicare, Medicaid, has been central to my work, since 2007. It's basically the healthcare cost side of public administration, healthcare program administration, and so it's specialized, but it happens to be where the expenses have gone up. And again, I have a lot of role models. One of my favorite public officials was actually an attorney that did board work. His name was Mike Cerisi, and he was the guy that prosecuted the Blue Cross Blue Shield tobacco lawsuits to help protect kids. against tobacco. That that's someone I see as sort of a role model in looking for. There's 480,000 Americans that die every year due to tobacco, and he was the guy that struck back and won. Something that is exceptional. That's an exceptional service. It's exceptional American, and I know that with vaping, tobacco cessation and getting kids dissuaded from tobacco is part of how we raise a healthy community. It's something that energizes me to be a part of this. Hartford has a train bell tradition. With nearby communities, there's no reason why we can't have a deeper relationship and have economic growth opportunities because of how affordable rail can be. I happen to believe that working with local business owners in the green housing movement is really important. We have an aging housing stock, and the FDR happened to not fund the Tennessee Valley Authority all the way up in Vermont, which is a real bone of contention. Folks in New England are on well water, are on heating oil. These programs were supposed to be funded during the Depression, and they didn't make it up here. And so, we can, lobby, with other towns and governors to make sure that we're getting the right infrastructure projects funded that we should. So we are, cost competitive, not paying for heating oil. I happen to be, as some of you were, at the 4th of July fireworks at South Kilowatt Park. I thought that was an exceptional 4th of July event. The music was great before the thunder hit, and it's a beautiful downtown. We have a lot of assets. We have a lot to brag about. There's great public schools. There's great community. Great nearby towns. I'd love to deepen our relationship with the Sister Cities program. I happen to be real passionate about all the different tribes of shepherds. Why shepherds? Well, see, shepherding happens to be the ancient tradition of horse shepherds, cattle shepherds, and providing clean, healthy food. And those traditions are not all represented in the U.S. Department of Agriculture. I happen to have worked at the Senex Land O'Lakes in my youth, where I was involved in consolidating 4 mergers together, which made me, a crop protection expert. Where I was involved in consolidating, all the crop protection billing codes between those big, 4 big companies. Where I was just a lowly intern, but became deeply aware. And we know that New England has land. We know that we have underutilized land, and we don't always look at the opportunity for shepherding. But shepherding happens to be the services that helped the early colonists survive. Farming in New England proved to be very difficult due to how rocky the soil is. Not everybody realizes that the Appalachian Mountains were some of the tallest in the whole world, and through erosion, they're now like a small portion of what they were way back when. And I happen to be of the belief that it makes sense for us to have a greater connection with shepherding, having more food grown locally, having more producers locally, having healthier, more sanitary conditions, for our residents and for our workers. That happens to be my area of expertise. I know that again, that's central to public health administration, to public administration. And again, I happen to be in that boutique field of healthcare administration, which, again, is more complex than some of the other parts of public administration. Listening to good people. I know that the Hartford Fire Department is outstanding. I know that the paramedics there would jump at the opportunity to work at the top of their license and to follow a career ladder up. Change the whole world for the better and reduce 911 calls. Because they're going on routine calls, where they get a 911 call, from the same patient, the same citizen. How can we better manage their care? Whether it's diabetes, CHF, COPD, in having deeper programs so that we can help people and not just react to the 911 program. I happen to be really passionate about it because my grandfather, Frank Patulis, who's in heaven, was the chief quality inspector of the Elmira fire engine factory, the American LaFrance, which they rolled off the modern fire truck in 1957 that every town bought in America. They're museum pieces now, and I feel strongly that our firefighters are able to do more and are able to follow up a career ladder. And I just think that policing, Hartford has such a high quality police department, which I had the privilege of speaking with a couple of the good guys in blue while I was at the 4th of July event, and just doing an outstanding job out there in the rain. And they had wonderful things to say about the town, which is such a cool culture. It's like the Midwest, right here, in Hartford, Vermont. I know that there's no town in America that thinks that they graduate, too many students into medical school. And, one of the things that I just think is so important is offering a competitive environment where our students are competitive and are beating benchmarks on being able to get into medical school, get into nursing school. The way to do that is to go the extra step in inspiring them. Going the extra step with our employees and trying to inspire them to improve their knowledge, not just of BLS, but, being a paramedic, being a lifeguard. There's excellent opportunities to learn and grow in town. And, it's not always folks locally that are tapped for those opportunities. It's an exceptional opportunity. The public works, again, I happen to have designed medical clinics. One of the really, difficult, we know the folks at the public works do a great job. One of the development issues in New England we have is, that we don't have buried power lines. We don't have, we didn't have all the public programs for subsidizing water. That's something that makes development a challenge. And it's something I'm very passionate about, though, of getting right, is, I happen to be a competitive swimmer. The thing about water that you can rely on is that it happens to roll down slopes. And that opportunity with our roadways of making sure that we're enforcing a 1-degree angle in our road development is one of the best ways to reduce potholes and increase safety on the road. Lobbying for that is something I'm very passionate about. Where I happen to grow up in a place that, the engineering programs at the University of Minnesota were so good. They were very aggressive about the 1% slope on highways, county roads. And you notice the difference if you ever go into parts of Minnesota that, that small change, you get fewer potholes, you get higher quality rain runoff, and you get safer roads. We know that the people of Hartford are good drivers, but we could save money on our car insurance if collectively we had a 1% grade, and that's something that those are the kinds of things that matter to folks, is having programs that help contain folks' cost, improve quality, and the thing that energizes, makes me passionate. I know that. Looking at the position description you described, managing up, I know how to make high-performing, good folks, look good, and I think that's one of our jobs as citizens, to manage up. And again, like I've been involved in organizations where I've had 20, 40, $80 million budgets. Of entirely physician expenses, of which is government dollars, state and federal. Some of the most restricted, of which I've done the job of containing opioid diversion, containing prescription diversion, which is the top area of expertise in public administration. Fraud deterrence, fraud prevention. Of which that work can be so easily and subtly done and carefully done in a way that makes the town look good. I happen to be a good listener. This format of just flipping this video to you happens to not play to my biggest strength. But I'm a consensus builder. My style is listening to my direct reports on the things that they want, and giving like if I can solve it, we solve it right there. Promise to look into it if I don't know the answer right away, and escalate things to the select board that are worthy of them. That as they look back at their service, they can look back with pride. That we had the right things coming to the board with the right agenda items, and like I've done with my physicians, is offering the option of a quality and financial report by video. That happens to be very successful. It's something that people respond really well to, and you just imagine me rattle through the town's finances in a variance report on video, and giving the selectmen days in advance before we meet to ask questions of me personally. And again, like that kind of transparency, I think is what helps towns run well. I know that I happen to be excited for challenges. I think I happen to have a bachelor's degree and a master's degree. I'm trained in big data. One of my styles is I went and got personality type certified by the Myers-Briggs, and so I'm able to provide the Myers-Briggs personality test to employees, to the selectmen. It happens to be a very useful process because some of the natural differences in personality type are the source of disagreements and don't have to be. Physicians that struggled for really long periods of time working with each other found that identifying the trait difference between them allowed them to understand each other better, to work together better. And I am excited and always thrilled about bringing that to a new organization, a new entity. I know that Mr. Cloud is the right person to flip this through. Thought I'd throw a quick video together to show you a sense of how I present. I'd be happy to do a deeper proposal and give you more background at your request. Have a wonderful day, and again, here's to Hartford, Vermont, having all the best.